Welcome to the Child Development Panel at the Health Matters Conference. My name is Dr. Simone Gill, and I will be your host. Children's development is multifaceted and is influenced by several developmental areas that are not mutually exclusive. As allied health professionals, although we might be experts in one particular area, we interface with other developmental areas in the context of working with young children. Children's development and our work with children is also influenced by the environments in which they live, learn, and play, as well as the healthcare system that they access. The purpose of this panel is to highlight some of Sargent College's allied health professional programs, as well as their alumni and current students. The programs included will be Occupational Therapy, Speech, Language, and Hearing Sciences, as well as Health Sciences. In the first interview, Dr. Sudha Arunachalam will interview Elizabeth McDermott, who received a Master's of Science in Speech Language Pathology from Sargent's Speech, Language, and Hearing Sciences Department. Dr. Arunachalam is an assistant professor of Speech, Language, and Hearing Sciences. Her area of specialty is in language acquisition and language processing. She teaches courses on how children acquire language, models that can be applied to language learning, and contemporary research conducted on child language. Dr. Arunachalam's research investigates questions such as how do children discover the meanings of words, and how do children with autism spectrum disorder learn new words. Her research interfaces with linguistics, cognitive and developmental psychology, and communication sciences and disorders. In the second interview, I will interview Pamela Vaughn, who received a Master's of Science in Occupational Therapy from Sargent's Occupational Therapy Department. I am an assistant professor of occupational therapy. My area of specialty is in motor development and motor function. I teach material relevant to what influences functional movement over the lifespan, how motor learning and motor control affect movement outcomes, and current research on motor functioning. My research investigates how individuals' bodies and task demands influence motor functioning across the lifespan. In my work, I use a variety of methods to examine how children and adults modify their walking patterns to navigate safely through the environment. My research goals are to create new methods to detect fall risks linked with obesity and to design innovative interventions that minimize fall risks associated with obesity. In the last interview, Dr. Bria Dunham will interview Sarah Hall, who is an up-and-coming health professional. She's majoring in psychology here at Boston University in the College of Arts and Sciences, but is minoring in public health here at Sargent College. Dr. Dunham is a clinical assistant professor of health sciences. She teaches material in the health sciences department on public health from an anthropological perspective. In her research, she focuses on the intersection between evolutionary anthropology and global public health, with research that addresses courtship, pregnancy, and parenting behaviors from cultural and evolutionary perspectives. For example, in one project, she examines how women make decisions about their maternity care, particularly in terms of labor intervention sought, site of birth, and provider type. Now, we'll turn to our interviews to hear their stories.
I'm Sudha Arunachalam. I'm faculty in the Speech, Language, and Hearing Sciences Department and the director of the Child Language Lab. And I'm here with Elizabeth McDermott, who is a recent alumna. Elizabeth, nice to see you.
Nice to see you too.
So tell me a little bit about what you've been doing since you graduated.
Definitely. So I work at a pediatric private practice right now in Needham, and it's called Children's Speech and Feeding Therapy.
And what are you doing there?
So I'm an official pediatric speech pathologist now, and my role includes providing treatment to a caseload of around 30 clients, so that ends up being about 6 clients a day. I also evaluate new clients that come in from different referrals to decide if they need therapy, and I also reevaluate current clients to update their treatment plans and to measure progress.
Mm-hmm. And what population are these clients?
The population I see is fairly diverse. My age range currently is between the ages of 2 and 10, but that varies, and their profiles vary too. So I see kids from, that have early expressive language delays, speech impairment, general receptive expressive language impairment, and even, more severe language impairment, and that's usually due to some secondary developmental disorder like autism.
Mm-hmm. And how would you say being a student at Sargent contributed to this current role?
Yeah, I think that the thing that I appreciated the most about Sargent was just the fact that it was a rehab department. A lot of speech pathology master's degrees are put in other departments, like educational departments or things like that, but Sargent being a rehab department really exposed me to truly multidisciplinary environment. Mm-hmm. And now when I'm working with clients, I approach them in a similar multidisciplinary way. Most of the clients I see are seen by a multitude of different therapists, whether that be other speech pathologists, occupational therapists, physical therapists, and coming from Sargent, I'm aware that there are lots of different forces at work on my clients. And this awareness helps me cater my treatment to best complement the other therapies my clients are receiving.
So are you working as part of a team?
Not at my practice, but we're constantly calling other physical therapists if they're working with them, calling the other speech therapists, knowing what they're working on so we can, fit that into our treatment as needed.
Mm-hmm. Great. And so you were also involved in research while at Sargent in the Child Language Lab. And how would you say that your research experiences affected you with respect to what you're doing now or your plans for the future?
Yeah. So while I was completing my research at Sargent, I was able to really pinpoint and develop and continue to develop 2 main skills that I think contribute to my ongoing success in my career. The first being how to ask questions and really how to ask the right questions, and 2, how to collect data. Mm-hmm. So I think really people underestimate the importance of asking questions. It was the first step that I took when writing my thesis, really developing a good, strong question as a base for everything that I did from there. And it's the first step that I take when I see clients too. What questions do I need to ask to really figure this client out? And then from there, collecting data to answer those questions. Sargent and my research with you taught me the best ways to collect data, how to interpret that data to get the answers that I was looking for. And I'm constantly collecting data on my clients as well. So really, I like to view each of my clients as their own little research assignments in and of themselves, constantly asking questions about them, collecting data about them to figure them out. And as a good clinician out there in the field, it's so important to research your clients, because even though you might have clients that have similar profiles, you might have several clients that have autism, several clients that have expressive receptive language impairment, each of those clients comes with a unique set of needs. And it's so important to research those needs so you can provide the best treatment possible for them.
Mm-hmm. So it's great to hear that your research and clinical experiences really informed each other throughout.
Most definitely.
That's great.
Most definitely.
What experiences did you have at Sargent that supported your ability to work with children?
Yeah, so I think what Sargent really gave me was a holistic view of my field. They provided me with opportunities to work with a ton of different patients in different settings, different age ranges. So when I graduated, I could make a really informed decision on what career path was going to be appropriate for me, which ended up being pediatrics. I really think that all too often people leave their grad programs with a degree and they still don't really know what to do with it. And that was never a problem I had leaving Sargent, really thanks to all the opportunities they provided me.
Interesting. So what advice would you give to current students in the MSSLP program who also might want to work with young children?
Yeah, so there are 3 main pieces of advice that I think I would give. 1 is, again, get comfortable with research. 2, get comfortable with writing. And 3, get comfortable with making mistakes and asking for help. Research is really the lifeblood of this career path. You're going to need to get comfortable reading it, and interpreting it, finding what research is good and what research is not so good, because unfortunately there is research out there that's not so good. And I think too, what's important is knowing how to apply the research to the clinical work that you're doing. And these are all skills that I'm still working on myself, and I think you just need to keep working on in your career, but knowing that it's an important skill to have is the first step. And then again, the other kind of piece that's going to be a part of your daily life as a speech pathologist in the field is writing. So getting comfortable with writing evaluations, goals, anything, emails, anything, it's always a skill you're going to need. So when you're in Sargent, take advantage of the people that are around you. Ask for advice, ask for feedback on your writing. Even if they're telling you you're good, ask them for specific feedback, because you can always improve, and it's really going to help you once you get out into the field if you already have a good foundation of that skill. And finally, get comfortable with making mistakes. I know I'm a speech pathologist. I know that the students in this field are perfectionists, and you just need to kind of let that go once you're working. You're not going to feel like you know what you're doing when you graduate, and you're not going to feel like you know what you're doing even when you finish your clinical fellowship. So get comfortable with making mistakes, and when you make those mistakes, ask for help, because that's how you learn. That's how you become a good clinician.
Terrific.
Yeah.
Well, thank you so much. It was really great to talk to you.
Thank you. It was great being here.
Right.
My name is Simone Gill, and I'm an assistant professor of occupational therapy and medicine. Hi, Pam. It's good to see you.
Good to see you too, Simone.
Thanks for coming. You graduated from the occupational therapy program in 2012?
Yes.
Tell us a little bit about what you've been up to. Where are you working?
Yeah, so currently I'm working at Cambridge Public Schools as an occupational therapist. Prior to working there, I've been there for about a year and a half now. I was working for Easter Seals, Massachusetts. So there I was contracted out to various positions, skilled nursing facilities, and public schools, and other areas where I was working with kids. But right now I'm still there per diem a little bit, but primarily in Cambridge Public Schools.
Great. What populations of clients did you work with in all of those different places?
So many, which was a great opportunity. Besides working with older adults in the skilled nursing facilities, in terms of children, at the public schools I was working with a variety of kids from ages 3 through high school, and a number of diagnoses. I had kids who were deaf and hard of hearing, I had kids on the autism spectrum disorder, kids with just more typical developmental delay, some kids with cerebral palsy, a few kids who were medically fragile. They had breathing tubes and more medically complicated diagnoses and needs. And yeah, and then I've also some children with emotional behavioral disorders. So quite a variety. And this upcoming school year I'm going to be working primarily with kids on the autism spectrum in substantially separate classes. So I've worked with kids in integrated classrooms, I've worked at specialized schools, I've worked at schools where there's a combination of substantially separate and integrated classrooms.
Well, you've had lots of different experiences.
Yeah,
That's great.
It's been a great opportunity.
Tell us a little bit about your position and the role that you've played in those different settings.
Definitely. So of course, with the different diagnoses and the different students, it has varied, but it always has that same basis. So I want to look at a child, and when they're in a school, I want to look at them as a student and see what they need to do to be able to participate fully academically, socially, physically within their school environment. So that involves screening students to see whether it's appropriate for them to go through a more comprehensive evaluation, or whether they just need some recommendations to adapt the classroom to provide some structure for the teachers to work with them most appropriately. If I evaluate a student, then I go through the whole process of figuring out what is difficult for them and why, and then how we can help them, whether that's providing direct occupational therapy services or, again, adaptations to the classroom, to the curriculum, and then providing direct treatment to them. And that can take a whole variety of approaches depending on the individual needs of the student.
Great.
And then, of course, collaborating with other staff as well, physical therapists, speech therapists, the teachers, parents, making sure that I'm communicating with them as well.
Great. Can you tell us a little bit about how being a student at Sargent helped prepare you for doing the job that you now do?
Definitely. I think that one of the things I appreciated the most about the OT program at Sargent was the bottom-up approach. So I really experienced a strong foundation of the theoretical approaches, of the basic understanding of what occupations are, how you look at an individual and their situation and really analyze what it is that they're doing, what it is that's difficult for them, and why those reasons are. So taking that foundation, I'm able to go into, in my case, the schools and work with these kids and really look at each one as an individual and determine what their needs are for their specific situation, and then from there provide treatments as necessary, provide individualized goals and approaches to helping them become more successful and independent.
Great. What experiences did you have at Sargent that really supported your ability to work with young children?
So I had 2 level 1 fieldwork experiences, and those are a variety of approaches. So one of them was more observational in an elementary school where I had great opportunities to ask the occupational therapist why you're doing that, and what is it that makes you think that this is going to address their specific needs, and also just kind of see how they have rapport with the students and the day-to-day life of an occupational therapist in a school. Another one of my level 1 experiences was for more of the capstone project, the GLE, Group Leadership Experience, where a fellow student and I went into a middle school classroom for students with emotional and behavioral needs and led a group for them. And so that was the whole process from establishing the needs of the students and determining how we could lead a group for those students that would most appropriately address those needs, with the aim of helping them become more able to function appropriately in their environment as students. And then I also had a level 2 experience, so my clinical experience at a sensory integration clinic here in the Boston area, and that gave me a great opportunity to see a more specialized approach to occupational therapy, and I've been able to use some of those skills outside of that specialized clinic in the schools and working with kids outside of that clinic as well.
That's wonderful.
Yeah.
Do you have some pearls of wisdom for students at Sargent who might be interested in following your path?
Definitely. I think that one of them is to really seek out any and all opportunities you can to work with children. So whether that's through field works, whether that's just through observation, but then also not discounting other opportunities. As I said, having that foundation of understanding what occupations are and how you look at an individual and determine what the challenges for them are and what approaches you can help take to make sure that they're independent and functioning to their best ability in their environment. All of those skills are going to be valuable when you're working with kids. So not discounting other opportunities as well. And then also really learning how to work with kids. I think it's a shift from enjoying kids and loving to play with kids to really understanding how to work with them. I think a sign of a skilled therapist is somebody who from the outside might see that you're working with them and it looks like you're just playing and having fun, but really you're thinking the whole time and you're really figuring out, okay, if they're doing this, how am I going to change this activity? How am I going to plan the next session? How am I going to adapt this so that I'm working towards their goals, so that I'm making sure that this is a progression towards the things that we need to be working on. And I think that's a unique ability to shift from loving kids and loving being around kids to actually working with them. And simultaneously working with adults as well. I think that making sure that you have the ability to communicate with parents and teachers and other staff in a professional way, being able to explain your rationale and the reasons why you're choosing to use different approaches or not use different approaches, and help them understand how they can join you in that process as well is very necessary. I think in the schools I have to shift very frequently from working with a student and child to working with adults, and being able to quickly shift between those modes of communication is very helpful. And then again, really focusing on those foundations. I think that if you have those foundations of the theoretical approaches, the ability to really analyze a situation and an individual and figure out what it is they need, you will gain those technical skills afterward. That is, it's going to come. And so if you have those foundations, really allowing yourself to be confident in those, knowing that you know how to be an occupational therapist.
Wonderful. Thank you so much. It was great to talk to you.
It was great to be here. Thank you.
Hi, I'm Bria Dunham, and I'm a clinical assistant professor in the health science program at Sargent College, and I'm here today with my student Sarah Hall to speak about her experiences in Sargent and her plans for the future. So Sarah, I know that you're a psych major at BU and that you're minoring in public health through Sargent College. Could you speak a little bit about your career plans for after graduation?
Well, I'm currently in the process of applying to graduate school to become a certified nurse midwife. I'm interested in working in an urban setting, either in a hospital or in a birthing center. I think that this area is really important because there are a lot of disadvantaged populations that can benefit from the attention and services of a midwife.
And why are you particularly interested in working in an urban setting?
Well, I think that disadvantaged populations may get lost in a large urban hospital, and these populations might not be getting the attention that they need. And I am interested in bringing the midwifery model into a medicalized setting, such as a hospital or a birthing center, where at the moment there might not be those kinds of options.
Could you tell us a little bit about how it is that you came to choose this career path?
Well, when I transferred to BU during my junior year, I originally wanted to be a developmental psychologist. But after hearing about Sargent, I became really interested in the programs and coursework that Sargent has to offer, particularly in public health. So I decided to pursue a minor in public health, and when I began my public health coursework, I became really interested in maternal and child health. And it was actually when I took your global health course and we discussed midwifery and improving health outcomes for women and infants across the world that I became really interested in this field and this career path. So since then, I've been really excited about just working with women and supporting them, particularly through labor and delivery, and helping them bring a new addition into their lives.
And could you tell us a little bit more about the specific populations that you're interested in working with as a midwife?
Well, midwifery is unique because it's one of the few professions where you can go from having one client to two clients in a moment. So I'm really interested not only in working with women, but also working with infants. The midwifery model is really supportive of facilitating immediate postpartum bonding between a mother or a set of parents and this new infant. And I'm really interested in supporting both the parents and the infant as they're making this big life transition. And then I'm also interested in working with adolescent women and teenage girls, not only teens who are pregnant, but also providing well woman care to this population. I think that this population is really unique because they have a higher risk of sexually transmitted infections, and they're also at a greater risk of experiencing sexual violence and rape. And then for pregnant teens, I think that they have a unique set of psychosocial and physical needs that pregnant adult women don't have. And I think that they might not even realize that midwifery is an option for them during prenatal and labor and delivery care. And I think that they could really benefit from the holistic approach of a midwife.
And could you tell us a little bit about what sort of role you see yourself fulfilling as a hospitalist midwife?
Well, I would really like to bring the holistic approach into a hospital. I really want to be warm and approachable because I think that a midwife is there for some of the most intimate moments in a woman's life, and I think that she needs to be both respectful but also professional. And I would really like to fill that role in my career path. And then I'm also interested in continuing the work that midwives have done for centuries to legitimize the midwifery profession. At the moment, there's still a lot of stereotypes about midwifery and a lot of misunderstanding and judgment. I think that a lot of people don't realize that midwives are trained professionals, and I'd like to continue this work.
And you've mentioned before being interested in being involved in research in your professional career as a midwife, in addition to having this public outreach role in legitimizing the profession and having your clinical practice. Could you speak a little bit about your research interests?
Well, I'm really interested in looking at evidence-based practices when it comes to birth. particularly looking at what works best at the time of birth, not just from a physical perspective, from what kind of interventions should or should not be used around the time of birth, what are the best health outcomes for a mother and her infant, but also looking at what we can do to respect women's wishes and really give them a positive experience during this time of their life. I think that improving these evidence-based practices will really help strengthen this career.
And how do you feel that being a student at Sargent has helped you in preparing for your career path?
Well, I think that my coursework in public health has taught me to look a lot at health as being not just the absence of disease, but also as the well-being of a person as a whole, both from a medical or biological standpoint, but also from a social and mental and emotional standpoint as well. And I think that midwifery really has parallels to this ideology, because midwives are looking at treating the whole person, not just a condition or a certain aspect of a woman's body. So I think that this has really helped me look at the big picture and look at how we can bring a different type of medicine into what is now a really biomedical field.
And you've been involved with me in research looking into women's preferences for maternity care. Could you speak a little bit about that research and about how it is helping you prepare for your career?
So our research is looking at the discrepancy between what women desire during the time of birth and the kind of care that women are receiving right now. So the research that we are working on, I will actually be presenting at the American Anthropological Association's annual conference this November. And so I think that this research is really going to help me with my career goals, because it'll help me understand what we can do as professionals to better attend women's needs and to pay more attention to what women desire and how we can make those needs come true.
And what advice would you have for prospective Sargent students that are interested in midwifery or in otherwise working with infants?
My advice to Sargent students would be to take classes that aren't necessarily on your course list. You might find that you have a whole new passion that you didn't even realize was there, or you might also find ways that a different course might relate to your passion right now. For example, I took a non-infectious disease course in Sargent as part of my minor in public health, and I didn't expect that it would relate to maternal and child health in so many ways. But we talked a lot about predictors of non-infectious disease, particularly things like tobacco use or geographic location or genetics, and how these things could impact a child down the line, even as a mother who hasn't even conceived a child yet or during pregnancy. One of the things that we looked at was maternal nutrition before conception and then also during pregnancy, and how this impacts children during childhood and adulthood for risk of diabetes and obesity.
Well, thank you very much for coming in for this conversation today.
Thank you.
We had an opportunity to hear from 2 alumni and 1 student about their experiences in Sargent as current or future allied health professionals. As you heard, our alumni work in a variety of settings that serve young children with various clinical needs. Their roles as allied health professionals are influenced by the settings in which they work. They shared how being students at Sargent contributed to the roles that they now have as allied health professionals, and about experiences at Sargent that aided in their ability to serve young children. Our current student discussed the types of clients that she hopes to serve, roles that she envisions herself playing as a health professional, and how being at Sargent moves her closer to her current career goals. All 3 interviewees gave wonderful advice to our current or prospective students of the speech, language, and hearing sciences, occupational therapy, and health sciences programs who might be interested in working with young children. On behalf of my colleagues, our alumni, and our students, we thank you for watching.